Hello and welcome to the second in our series of basic Pilates principles. So today we're going to be looking at diaphragmatic breathing. So the reason we've chosen to look at this is it's probably one of the most important things that we can do. In relation to Pilates, diaphragmatic breathing can help us engage and relax the core. If we're not breathing correctly, then it's really difficult to engage that pelvic floor and that core. We will go into that in more depth on the activation of the pelvic floor session coming up shortly. But other benefits of diaphragmatic breathing are it can reduce any pain that you may be having, lower back pain, neck pain, shoulder pain. It can reduce your stress, which in relation to that will reduce your pain. So, as previously said, it will also reduce your stress and anxiety levels by activating your parasympathetic nervous system. That this system helps to calm your body. It's your rest and digest system. So it works with regulating your heart rate and slowing it down a little bit. So if we slow down that heart rate, we can help to reduce stress and any of the health complications that come with stress. It can also help drain out any toxins throughout your body by working with the lymphatic system. Lots of lymph nodes that are located underneath the diaphragm, and if we're using it properly, it will help to drain out those toxins. And it will also help with digestion by helping to expand the belly and deflate the belly. Will help those organs to move and digest our food properly. Many benefits to diaphragmatic breathing. So we'll go ahead and start teaching you how to do it. So before I teach you, I just want to tell you a little bit about the diaphragm and where it sits so you can really understand what you are doing when we do it. So the diaphragm sits just underneath the rib cage here. And when we take a breath in, that diaphragm moves down. When we take a breath out, the diaphragm moves back up. So we breathe in, it presses down. We breathe out, it comes back up. So this is why when we talk about diaphragmatic breathing, that we're talking about almost breathing into your belly and allowing the belly to expand, because that means that the diaphragm will come all the way down. Those of us who may be stuck in an office or working at a desk regularly and find ourselves often in this position, may not be if you're working at a desk, but generally sitting here and you're all quite tight through here. It's going to be really difficult for that diaphragm to move properly because this is all compressed through here. Your front body is very tight. You're tight through your hip flexors, which run across the hip and connect into the lower back, and they share a fascial connection with the diaphragm. So that's how that diaphragm moving properly can help with your lower back pain. So what we need to do is looking at getting into that Pilates rest position that we talked about last week, and then really trying to get that diaphragm moving properly with it. So we'll start by lying on your back because it's a lot easier to practice this breathing lying on your back because you can open up through the front body. If you tend to sit and crunch, again, we can't open up and use that diaphragm. So lying on your back, so we're in the Pilates rest position, which we went through in the first session. So onto your back, find your Pilates rest position and finding that nice length through your spine. We'll bring your hands together so that your middle fingers are touching here, and then place your hands onto your belly. So from here, we're going to imagine there's a tiny little balloon in your stomach. And when you breathe in, you're going to inflate that balloon, and you should feel here your middle fingers slightly separating. Then as you exhale, imagine you're deflating that balloon and feeling those middle fingers reconnecting slightly. So we inhale, inflate the balloon, and exhale, deflate the balloon. So you should feel just the stomach rising and falling here. If you want to check that you're not breathing too much from the chest, just take one hand onto the chest, and you should feel that bottom hand, the hand that's on your belly, rising and falling more than the one on your chest. If you're really still struggling with this, and you feel that you can only get the breath into your chest, it may be that you need to get a little bit of an abdominal release or do some stretches through the front body. So you may need to seek further help from a physiotherapist to release a little bit through the abdominals, or show you some opening stretches for the front body here. But this is how we should naturally breathe. If you look at a baby or a toddler, you will see that they breathe naturally into their belly. And we tend to just develop these postures that prevent the diaphragm from breathing properly. So once you feel you've got that lying down, try coming up into a seated position. So if you're not comfortable seated on the floor, that is fine. Come and sit on the edge of a dining room chair or the edge of your sofa, or perhaps take a block underneath your bottom. You can do this in kneeling, any kind of seated position. And exactly the same again, so place middle fingers together and then hands onto the belly. And then we'll inhale, inflate that little balloon, and exhale, deflate that little balloon. Now you may find that this is a little bit harder when you're seated, particularly those of us who like to tend to sit and curl a little bit here. We're used to not allowing that diaphragm to move and constricting this whole area. So we're trying to force this all open to expand those lungs properly. And remember that that balloon is 3D. So yes, we're looking at that expansion forwards and backwards, but we also are looking at that expansion of the balloon laterally, so out to the sides. Well done. So once you've got used to just breathing your natural rhythm into your belly, you can start playing around with it and doing different breathing exercises. So some of these we will visit as well with some of our recorded videos. But simple one is to just practice some deep breathing. So you may want to start this again lying on your back. Just because it's a little bit easier first lying on the back. So find that Pilates rest position. And then inhale, inflate that balloon and feel those fingers spread apart. Inhaling as deeply as you can. Then exhale it all out. Inhale as deeply as you can. And exhale it all out. Really imagine that balloon completely expanding and filling with air, and then completely deflating, getting rid of all that air. And try to inhale through the nose, because this actually helps to activate the diaphragm a little bit more. You will feel if you try to inhale through the mouth, you want to then breathe a little bit more from the chest. So when you take that deep breath in, try and inhale through the nostrils. Now obviously when you take these deep breaths, you will feel that chest rise a little bit because you're filling up every inch of your lungs. But we still want to feel that breath coming all the way down into the belly, almost into your pelvis and lower back. Let's just take one more deep breath lying down. Good. If you feel you've managed to do that quite well lying down, then we can come and try it in a seated position again. You can also try this in standing, any kind of position, because you want to be able to use these deep breaths for any time that you're feeling a little bit stressed or feeling that you can't get that breath deep down into the belly, just to really try and expand through that diaphragm in the front body. So exactly the same again, make sure you're sitting nice and tall and not slouching back, so maybe sit yourself on the edge of the bed, edge of the chair, sofa, wherever feels comfortable. And then we'll inhale, expand that balloon completely, and exhale, get rid of all the air out of the balloon. Good, inhale, expand that balloon, growing nice and tall through the spine, and exhale, deflate completely. Well done. One more. Inhale, really expand. And exhale, really deflate. So a couple of good things for you to try there. If you're feeling any stress, any tension, just take a few moments to take 3 nice, deep, diaphragmatic breaths. So breathing into the belly. And perhaps trying to take note of how you breathe throughout the day. If you're noticing you're starting to breathe up here, take those deep breaths and send it down into the belly to just calm yourself down a little bit and make sure we're opening up through the front body, opening up those muscles to release any pain through the body and stimulate our nervous system, our lymphatic system, and keep lots of oxygen running throughout the body. If you have any questions regarding this video, just ping us an email and we'll try and help you as much as we can. Thank you for joining us today.